So, hello everyone. We are here with Unpause Life to talk about the continuum of a woman's life into a period where her body changes yet once again. And with us, we have today Dr. Anita Shah, and we're very happy to have her. We'll give her a few minutes to join us. It seems like women start to think of themselves lesser and lesser as they move from their reproductive phase to the other phase of their life, the post-reproductive phase. And we forget that she's still the same woman, she still has desires, she still has a life to live. Many things might be happening at that time. For some people, the children are growing up. For others, the children may have already left home, or they may have started families of their own. And how do we look at our lives in this phase of our life, simply called menopause? And so we're going to give our guest a few moments to join, and then we will begin our discussion starting from today throughout this week, spread over time, to look at this different aspects of women's health in terms of this period of menopause and post-reproductive period life for women. And that could be in terms of food, that could be in terms of hormones, that could be in terms of bone density, that could be in terms of so many different things. And we welcome you to write down topics that are of interest to you so that we can look into them a little bit more deeply and understand. In my living life, and I am also at that phase at 52, I don't remember anybody talking about what women are going through. There's a lot of talk and buzz around birth, about youth, but nobody talks about this period called midlife, and there are different names that what do those mean. And we are supposed to have these conversations because we have practically all our life ahead of us. So just checking if Dr. Anita is here. Okay, we already have people with questions. We're going to note this down, and we're going to talk about what might we bring in terms of self-care and self-love for women arriving at menopause. Thank you, Jagsvatwa. Feeling low and gaining weight, I know. So much is changing, and it's also interesting that what changes are coming, how they are valued in society, and how we begin to see ourselves. So yes, of course, these are very important conversations, and we want to take them up. We began, Tanvi, she's here on this group, and hi Tanvi, and I thought that we've been talking endlessly about pregnancy, birth, and now we need to look at women's continuum past that. So, hello Dr. Anita. Hi Tanvi. How can I, yeah. I'm just inviting Dr. Anita to join us. Okay, just give me a moment. Dr. Anita, if you're getting a request from us, could you please join? Oh, okay, you're unable to join. Tanvi, can I pull you in to also do this with me? Um, just to support. Okay. Yeah. Hi, Tanvi.
Hi, Divya. Okay, just give me a moment. I'll try to add Dr. Anita.
Yeah, it just says unable to join.
Divya, I won't be able to make her join
Yeah.
because you're logged in through the Unpause
Yeah,
account.
I understood that. I understood that. I just keep sending her an
Just give me a
invite and
moment.
it,
I'll give her a call and I'll explain it to her.
oh. So while we wait for her, let me tell you a little bit about our guests. Dr. Anita Shah has been a practicing gynecologist in Surat since 1998. And she's been the organizing chairperson of the World Conference on Population Stabilization in February of 2003. She's also been the organizing secretary of National Conference on Indian Menopause Society, and this was in 2009 in Surat. She's the founder, chapter secretary of Indian Menopause Society in Surat and national chairperson of Club 35 Plus committee. She is the ex-Secretary General of Indian Menopause Society in 2020 and 21, and now is the President-elect of Surat Medical Consultants Association in 2022. And so we're just waiting for her to join and we will begin. And the way we organized this for you is we start with some information starting today and then building it in layers over time so that you can consume this information and use it for yourself. So let's see. Still waiting. Over a period of time, I have. I've sent her a request again. Meanwhile, I'd like to welcome everybody who's joining us. This is our very first interaction in a live on Instagram about menopause. Unpaused life is all about this is not a pause in your life. This is your step over to a different life. I'm sorry, it still says unable to join. Yes,
Yeah,
here she is. Welcome, Dr. Anita. I got an
okay.
opportunity
Yeah,
to, to give your introduction, and I'm so glad you're here. Thank you so much for giving us your time. This is a really, really important subject, and already we have people asking questions, but let's start with my questions first.
right.
So, everybody talks about menopause like, oh, menopause, as if it's an event. And having been through this journey myself, I'd like you to tell our listeners today and in the future, what does it really mean? And is it just one event that happens, or is there a period of time like other processes of our life?
Yeah, actually, menopause, it is a retrospective diagnosis. When a woman stops menstruating for 1 year, then we retrospectively say that she has entered menopause. So it is not a single 1 day or 1 month like that, but so many activities are carried out. As such, we know that the ovary is functioning throughout from a girl since the adolescent period, and as the woman matures, the ovaries function a little bit, it is just decreasing, and finally the ovary stops working. And due to that, we all know that these ovary produces certain hormones which are responsible for all the menstrual activities, as well as childbearing, as well as all so many activities which are feminine specially. And due to the lack of these hormones, especially estrogen, progesterone, testosterone, due to lack of these hormones, a woman has to face so many problems. And exactly, we call that menopause is not only having issues. There are issues before starting menopause, and even after the completion of menopause.
Yeah. So
So
when we were
usually,
talking earlier, you said
yeah,
midlife. You used the word midlife. Could you
right,
just
right.
speak to that?
Right. Actually, just before 5 minutes, we completed one webinar with our Indian Menopause Society and Surat Menopause Society and Club 35 Plus, that what a mature woman want. So midlife, it is the life. Usually we know that childbearing is usually up to the age of 40. Of course, now due to the era of IVF and surrogacy, that may be prolonged, we can say. But as such, after the age of 40, usually the ovarian function diminishes, and the ovaries that are lying in the ovaries, they usually exhaust. So what happens that during that perimenopausal phase, before 5 to 10 years of actual menopause, in India, usually the age of menopause is considered as 47 to 48 years. So before 5 to 7 years of this actual menopausal age, there are certain changes in the hormones, and due to that, females are usually facing irregularity in the periods. Maybe there are weight gain issues and other heart flushes. These are very common symptoms during this perimenopausal phase. Usually, what so many times women feel that after the age of 40, chances of conception is nil. But of course, it is very less. But we come across certain women that even at the age of 42, 43, 45, they may be conceived sporadically. So this is very important that a woman of a midlife woman should take care of in that way, that they should take contraception properly till the age of 45, 46, because chances of sporadic ovulation will be there, and very rarely the woman may get conceived also. So regarding I would talk regarding this perimenopausal phase. Mainly, women are facing irregularity in the periods, and all most of the women, they understand that this is due to the, जैसे कहते हैं ना कि अभी ये मासिक जाने वाला है, उसके लिए ये तो होता है. But actually, Divya, there are so many other causes for irregularity of the periods, heavy menstruation or painful menstruation. So unless and until it is proved otherwise by a proper gynecological checkup and proper ultrasonography done, then only it should be labeled that it is only due to the, approaching menopause.
Yeah.
So my personal advice to each and every woman of this perimenopausal age is that only, that they should take care and they should get themselves examined by a gynecologist every year. You must be aware of that there are 4 cancers very common in the female, and all those are usually occurring after the age of 40. One is cervical cancer, second one is endometrial cancer, third is ovarian cancer, and fourth is breast cancer. So all these cancers, if they are detected in an early stage, they can be treated very nicely, and the expectancy of the life expectancy usually that can be prolonged. So usually when we do gynecological checkup, we do local examination. and we just have a look on vagina, vulva, cervix like that. So if any growth is there on the cervix, if there is any erosion, जैसे हम लेमन टर्म में कहते हैं कि चांदी पड़ी है, ऐसा सब लोग बोलते हैं. तो if it is like that, that we can come to know, we can advise the patient accordingly. One, you might have heard of that pap test.
Yes.
Now on the day of Narendra Modi's birthday, our Prime Minister's birthday, we had done all over India so many pap tests, and group of gynecological involvement. So what I say, that pap test is a only screening test, in that we are taking a little bit secretion from the cervix, and at the with a brush. Nowadays we are doing liquid based cytology, so that gives more better result, and that can be repeated every 3 yearly. Previously we were doing conventional pap test. So this is one of the very important screening tests to find out the cervical cancer in very well advanced stage, very early stage, and that's why clinical examination is a must. What another thing I would like to advise, that every year one sonography should be done, especially transvaginal sonography. Vaginal sonography can be done abdominally as well as vaginal, through vaginal route. So transvaginal sonography usually gives us the exact thickness of the endometrium, especially if it is more beyond the certain limits. We usually advise for DNC and endometrial biopsy to find out the chances of cervical endometrial cancer. By sonography, we can find out the size of the uterus, is there any fibroid or not, any ovarian enlargement is there, that also can be come to know. So all these are very necessary things. Sorry, you want to say something?
So what I'm hearing you say, I said that what I'm hearing you say is that we are sweeping a lot of women's health under the big umbrella of menopause. And you may see many signs and symptoms that may have nothing to do with menopause, or as you are advancing in age, you might want to keep a lookout on your health to catch symptoms early. This is what I heard you say.
Yeah.
So
Exactly.
if you would also just mention a few symptoms that would say that this is perimenopause.
Right, exactly. During this perimenopausal phase, first common symptom is irregularity in the periods. Second one is hot flushes. They are very common. Usually a woman will complain that I am sitting in the AC or below the fan, then also I am feeling so much hot. It is of course momentarily symptom, and sometimes if mother or elderly woman in the family complains like this, the other family members will make a joke of that oh wow, mom is doing this, is so much cold room, and then also she is having this type of complaint. So it is very common, and especially whenever these hot flushes are there, even at night time also they can be there, and may just make a woman to awake in the night time, so that a woman may not be able to get the proper sleep. But what I would like to advise, if the woman is having this type of hot flushes, they should just use the layered clothes. Instead of having synthetic clothes or single tight clothes, they should use layered clothes. They should avoid triggering factors like tea, coffee, hot drinks. And if they are doing that, or very spicy food and everything like that, then they can just get rid of this hot flushes. If it is not relieved, even if then they should consult gynecologist, and they should take certain medicines. Another very common symptom is weight gain. People will usually say that I am eating so less, then also I am getting put on the weight. Usually fat deposition is taking place lower abdomen, hips and thighs, and so women usually don't like the deposition of fat at these area, and they will feel that I am getting so much obese, what I should do, madam. So this type of complaints are also very common. Another very common complaint, Divya, is they are having psychological problems, may have anxiety, irritability, So many times it happens that they feel very bad that, oh, my mother-in-law just told me like this, my daughter didn't tell me this, my daughter-in-law told me like this. So choti choti baaton mein they feel very much, they took it very tightly.
Yeah.
And they feel very bad. Sometimes they are having so much depression. They feel crying without any reason. And certain females are having this depression so at so much high level that they may get even suicidal tendency. And so many things. Another very common symptoms during these phases, repeated vaginal infection and repeated urinary tract infection. A little bit they may have sexual deprivement. What happens due to this lack of estrogen, the urinary tract having repeated vaginal infection and urinary tract infection. They may have urgency of urine. They can't control their urination. They have burning in the vagina, burning micturition like that. So these are very common symptoms in the perimenopausal age. Another one thing I can say that there is during this perimenopausal phase, the starting of a little bit bone health is also very much important, because there is some weakness in the bones. Actually, the bone becomes weak, and gradually they may become fragile. And you might have heard of osteoporosis. In later age, a woman may develop osteoporosis. So estrogen is having cardioprotective effect also. So before menopause, we usually very rarely see the cases of heart attack in female, right? But after the menopause, both in female and male, the chances of heart attacks are similar. In earlier age, it is less in female. So these are the very common symptoms in this perimenopausal phase. And whenever a woman is having this type of complaint, they should consult their gynecologist. So Divya, I'll be very happy to say that our Indian Menopause Society, it is a national association. And I was national secretary of that association last year. Just I have finished my tenure before 2 months only. So our main motto is that only we just would like to spread the awareness regarding menopausal issues in general women. Most of the female just are there, have very so many myths regarding menopause. कि yeah, ये मुझे menopause आ जाएगा, I have to face these and that, and I'll be having so much suffering like that. But if a woman is having proper knowledge regarding the issues of menopause, they can easily come out of it. Just like adolescence is the starting of the woman's life, similarly, menopause is the later part of the woman's life. But as you told that menopause is nothing to stop. It is me no pause. Means I don't want to pause. It is just pause. I don't want to stop. We usually say that life begins after 40. Because after the age of 40, usually there is a बच्चे भी बड़े हो जाते हैं. So usually we don't have to bother for the children. Husband has usually well settled in the business. So a woman is having time to look into her. So we say that life begins after 40.
Yeah, that's such a hopeful message, Dr. Shah, because every time we say menopause, it's almost dismissive of women into old age and in the background, as if your life is finished. And even though I'm hearing you're saying that you have these symptoms, they are not the end of your, with the right guidance, with a little bit support, with good diet, with good exercise, you can reclaim your life. And what I heard you say is that at this time, you can reclaim the life for yourself. You have lived your life for your family, you've done your duties, you can start to live your life for yourself. That's such a heartening message. Is there anything that you'd say? So, a lot of people have these myths, because when we go to doctors, and somehow I feel when we tell them a few of our symptoms, like thyroid not working or a certain symptom, everything comes under the category of perimenopause. So just inform us to the idea of when you said that the average age of menopause in India is about 47, 48. What could be a time frame that would be perimenopausal? And I know that there will be variations and each case is
Right.
distinctive. But what, like you said, like around the 40s, you can think of
Yeah,
it.
around the 40s. Yeah.
And
So
sometimes we hear really young women being told at 32, 35 that they are perimenopausal. Tell me a little bit about that.
yeah, usually if the woman gets menopause before the age of 40, we called it as premature ovarian insufficiency. So,
Yeah,
so many times if nowadays we come across so many patients in that way also, that those who are getting loss of that menstruation even before the age of 40 means 35, 36 like that, or even earlier to that also. So, as such, perimenopausal age we consider between the age of 40 to 46 like that. But in certain female who are just going to get premature menopause, that can be considered a little bit earlier.
yeah,
Similarly, what you told about thyroid, hypothyroidism is also having similar types of symptoms. So
yeah,
whenever a patient is having midlife woman is having complaining of this all these symptoms, we always have to rule out that she is not suffering from hypothyroidism. So that's why basically we usually advise thyroid function test as well as sugar test to rule out diabetes and hypothyroidism, because nowadays they have become very common. Thyroid abnormality, hypertension, diabetes, they are so common
yeah. They're
that
considered normal to have now.
right. We can say that every third person is having diabetes in our India.
Yeah,
So we have to be very cautious. And what you told about that, if proper diet as well as exercise and proper advice is taken, then they are not getting any much issues. See, Divya, I would like to say that most of the female feel that if they are having menopausal issues, they will have to take only menopausal hormone therapy.
yeah,
But it is not like that.
yeah,
Unless and until it is not relieved with, we are always following holistic approach. And
yeah,
in holistic approach, we always advise lifestyle modification.
yeah,
You have to make your life in that way. You have to plenty of fluid you have to take. You
yeah,
should do exercise every day. You should take proper diet, especially full of vegetables and fruits. High
yeah,
protein diet you should take, because there is muscle wasting is also very common during this age.
yeah,
So high protein diet full of vegetables and fruits, then only and along with you should have some yoga or meditation,
yeah.
just that also very much helpful.
Yeah, that
If
was my
unless
next question, that how does stress factor into these symptoms being aggravated or the hormonal balances being off? Does stress play a role or not?
Right. Stress is playing role in each and every stage of life, Divya. I can say that nowadays we are coming across so many patients of infertility also.
Mm,
And there also we find that as nowadays woman has become career oriented, they will postpone their marriages, they will postpone their planning for the babies. And that's why we come across so many patients of infertility also. And I would like to say that stress is playing very vigorous role in that also. Similarly, in the later age also, stress is having very much important role in aggravating the symptoms.
mm,
And that's why we always advise that simple walking in the early morning in the open air, that will give a release of good hormones in your body, and that will make you feel good. So this is of course important, and along with that, yoga, meditation, a little bit spirituality, that will definitely give you a relaxation in the life, because now we see that everyone's life is full of stress in each and every
yeah,
corner of the way, we can say that like that.
yeah, yeah. So Tanvi has a question, Dr. Shah, and she's saying that if the world average age for menopause is about 51, 52, why is Indian age lower by about 5 to 6 years?
Yeah, because in India, usually we saw that there are certain monarchies also very early.
Ah,
Uh, age of menarche also, now we come across that it is earlier than about previously we were seeing that usually the menarche was very late, 10 14 15 years like that, but now we come across that menarche is also very early, at the age of 8 9, many of the girls get periods. All this is due to the environmental changes, and of course depends on the nutrition of our patients and our local people like that, and that is why there is a difference in the menopause in the western countries and in comparison to India.
Okay. We had a question earlier about hair fall and hair thinning. And I
Yeah.
think that is a very concerning question for all of
Right.
us.
Yeah. It is very concerned, but it is one of the due to the lack of estrogen, and that is why the skin becomes very dry, the hair becomes very thin, and that's why there is hair fall also very common. And to protect it, you should have healthy diet and healthy life, stress-free life, that will to some extent. But of course, there is a it is a natural physiological thing, and you can't protect it completely. I can say that my hair were so long and so thick before many years. Now, since few years, they have become very thin. So it is a physiological change, and we have to accept it.
Yeah. It sounds like we need to love ourselves as we are a little bit more.
Right,
The way we are today, we have to love
right, right,
ourselves and
right,
then love
right,
who we are a little bit more for us to have me no pause in life.
right.
I think
Yeah,
we've
I
looked
would
for love
agree.
from everywhere, but now we need to love ourselves at
Right,
this place.
exactly. And we have a very good slogan of our Indian Menopause Society: fit at 40, strong at 60, and independent at 80. We
Wow,
want that each and every woman should have this. And I have elaborated it last year when I was secretary, that fit at 40, fancy at 50, strong at 60, sexy at 70, independent at 80, naughty at 90, and healthy at 100.
that is wonderful. That
So,
is a that is
usually
fantastic.
we always advise the patient like that, Divya, that during this perimenopausal and menopausal age, you should develop your hobbies. What happens so many times in our younger age, due to our responsibility of the family and kids, we have to leave certain hobbies. Suppose I have a good hobby of singing or drawing, but due to my other work I had to leave it. So during this period you should develop your hobbies: singing, dancing, drawing. Dance is also a very good exercise.
Yes,
And you would love to listen that our Indian Menopause Society is having one club 35 plus. Under the banner of that, we always involve the people over the age of 35, and we give them good platform for various activities. And in Surat, we are running club 35 plus, and during in this club, we are giving platform to each and every woman who are over the 35 years. Every year we are arranging one dance program, and in that 35 to 70 years female, they are just getting platform. So many are happy to say that we have just come on the stage after 20-30 years, and
yeah.
everyone is so happy and encouraging in their life. And just the main motto of our is that a midlife woman should be healthy, happy in each and every way.
Yes, thank you so much. That's such a wonderful message. And we're making a note of Club 35 Plus. That seems like
Yeah.
a wonderful idea. We've lived our lives for everybody and we've done our bit, and it's time to live a little for ourselves. Thank you so much for being here with us, giving us your valuable time. And I am sure in the future, हम आपको फिर बुलाएंगे. We will invite you over and over again.
Okay,
Such
sure,
a
sure.
such
That
a
will
positive.
be so happy. Okay.
Thank you, Anita ji.
Okay, thank you. Bye.